The name comes from the changes in the pancreas, which is damaged from early on in life with most people with cystic fibrosis and gradually replaced with scar tissue, fibrosis, and fluid-filled spaces, cysts. The gene responsible is called Cystic Fibrosis Transmembrane Conductance Regulator, or CFTR, and is located on the long arm of chromosome 7. This gene controls the movement of salt and water in and out of the cells, so the lungs and digestive system become clogged, making it hard to breathe and digest food. It is carried on the recessive allele and is most likely inherited the defective gene from both parents. If both parents are carriers, there are 25% chance that their children will have cystic fibrosis, 25% chance they won't have it, and 50% chance they'll be a carrier. If cystic fibrosis suffer as children with a carrier, it's 50% chance that they'll be a carrier and 50% chance they'll have cystic fibrosis. And if a cystic fibrosis suffer as children to a normal person, they'll definitely be a carrier, but they won't have a disease. Both parents must at least be a carrier for it to be passed on.
The patient will require daily physiotherapy to prevent the thick, sticky mucus in the lungs from blocking the airways, which can reduce infection and prevent lung damage. They also have to attend regular hospital appointments. 85% of cystic fibrosis sufferers cannot produce enough enzymes for efficient digestion and absorption of food and need to take additional enzymes by mouth with each meal. 18% of babies suffer from meconium ileus, which is bowel blockage, often resulting in surgery. This increases the risk of rectal prolapse, abdominal pain, and gastroesophageal reflux. 40% of children will develop liver disease, 25% of adults will have diabetes, and 66% of women will suffer from urine incontinence compared to only 7% of normal women. It's also increased risk of gallbladder disease, osteoporosis, arthritis, nasal polyps, clubbing, vitamin deficiencies, and gallbladder disease. Puberty starts later in people with cystic fibrosis. Girls usually don't start their period until they're 14. Men won't reach their final height until they're 16 or 17 years old, and 95% of men are infertile due to the genital ducts being blocked, although sperm production is normal and they can have children with fertility treatment. 2/3 of women are able to become pregnant spontaneously, and all cystic fibrosis sufferers' children will definitely be carriers. And if common mutations are excluded, there's still 1 in 500 chance that the child will have cystic fibrosis. The average life expectancy is about 35 years. With new medicines and treatments being developed, a baby born today can be expected to live into their 40s or even 50s. As lung disease and cystic fibrosis progresses, it becomes more difficult to transfer gases through the lungs and out of the bloodstream. Breathing becomes more difficult, even at rest. The low levels of oxygen and high levels of carbon dioxide in the blood eventually have an effect on the heart and blood vessels. There is gradual development of increased blood pressure in the blood vessels of the lungs, pulmonary hypertension. When it is clear that an individual has severe lung disease, a lung transplant is needed. 5% of lung transplant patients will die immediately, 75% will survive over 2 years, and 50% will survive over 5 years. All lung transplant patients will need to take anti-rejection drugs for the rest of their life. Lung function decreases by 13% during pregnancy, but most of this can be regained afterwards. Pregnancy also increases illness, but doesn't impact on the mother's long-term survival. The Cystic Fibrosis Trust and other charities has concentrated research funding on developing gene therapy, which involves trying to correct the basic defect by adjusting the CFTR protein and carrying normal CFTR into the cells. There's also ion therapy, which involves correcting the defect on the surface of epithelial cells so that the depth and concentration of the liquid layer on the surface of the cells return to normal. Cilia should be able to then clear mucus more efficiently from the lungs. Progress is also being made on better anti-inflammatory drugs and anti-infective agents for use through nebulizer instead of intravenously like the ones used today, which assist with mucus clearance. Progress is also being made towards bronchodilators and high-frequency oscillation vests, which are wear for 10 to 40 minutes instead of physiotherapy. They're not available on the NHS currently, as they each cost £25,000.